Welcome back to The Explainer. Look, if you're working in community pharmacy right now, you already know the deal. Keeping up with the absolute flood of clinical updates, local guidelines, and new admin mandates, well, it basically feels like a full-time job all on its own. So our goal today is to just cut right through that admin fatigue. We're taking the most vital updates from the 16th of June 2026 weekly briefing, and we are delivering them to you straight, in a concise, action-oriented way. We've got a lot of crucial ground to cover today, so let's just jump right into it. Okay, here's our roadmap for today's explainer. 1. New vaccination services. 2. Mandatory vaccination recording. 3. PQS and scheme deadlines. And 4. Local pharmacy updates. All right, diving right into Section 1, new vaccination services. So, starting in late July, community pharmacies are going to launch a brand new one-off meningococcal B, or MenB, vaccination service. This is an advanced service, and it's specifically targeting young people at the highest risk, right before the autumn school term kicks off. It's a really great public health initiative. Now, who exactly are we targeting here? For the new MenB service, your cohorts are going to be Year 13 students, plus any under 25s who are heading off to university or residential further education for the very first time. But we also need to talk about flu. Looking ahead to the October 2026 National Flu Program, the Children's Flu Service is actually expanding. It's moving beyond just toddlers to include clinically at-risk children and school-aged catch-ups. And for adults, eligibility is expanding too. It now includes people experiencing homelessness who are aged 16 and over, so specifically folks sleeping rough or living in hostels. Moving right along to Section 2, mandatory vaccination recording. Grab your calendars because we have an absolute hard deadline coming up, September 1st, 2026. By that exact date, all community pharmacies in England literally must record all NHS vaccinations in the Record of Vaccination Service, which you'll hear called RAVS. You really need to act on this one immediately so you can iron out any IT gremlins way before the winter rush hits. When you actually head over to the NHS RAVS portal, just a heads up that manual sign-up is going to be required for most of you. However, if you're part of a larger enterprise, so 50 or more branches, there's actually a bulk onboarding option available via email, which should save you a ton of time. Let's actually break down how to set this up, step by step. First, one representative has to register the pharmacy branch on the website. That person becomes your initial lead administrator. From there, they can set up the rest of your users. Now, what we strongly recommend is setting up a second lead administrator just for business continuity. You know how it is. Furthermore, if your lead administrators aren't actually physically working on site at the pharmacy, you have to assign at least 2 on-site reps with the administrator role. Why? Because only those specific roles can actually add the required vaccine information into RAVS. I know, new IT systems can be a massive headache, but there are some huge administrative benefits here. Once you log your national flu and COVID-19 jabs in RAVS, the NHS Business Services Authority pays you automatically through the Manager Service or MYS portal. No extra claims needed. And actually, speaking of MYS, please do take 5 minutes this week to log into your portal and check for any unresolved referred back items. Make sure you're getting paid for the work you've already done. And one final, super important rule: RAVS cannot be used for any private vaccinations. Period. You've got to keep those strictly separate. Okay, shifting gears to Section 3, PQS and scheme deadlines.
So, the full details for the 2026/27 Pharmacy Quality Scheme are officially out. And guys, this scheme is worth a whopping £20 million. Looking at the timeline we've got here, your first major financial window is coming in hot. You absolutely must claim your aspiration payment between the 13th and 28th of July 2026. Oh, and while we're talking about tight deadlines, don't forget your DSPTK submission is also due imminently, so get that sorted. Looking a bit further down the road, your final PQS declaration period is going to be in February 2027, and you have to have all your evidence gathered to prove you've met the requirements by the 31st of March 2027.
To actually help you cross that finish line next March, Community Pharmacy England has dropped this, the PQS Action and Evidence Portfolio Workbook. Please do not sleep on this resource. It's incredibly useful. It includes the exact drug tariff wording, a comprehensive checklist, and even a template action plan to help you track your compliance with all the different gateways and domains. Oh, and a super quick but highly time-sensitive heads up for any pharmacists or pharmacy technicians out there who are looking to expand their professional horizons. If you're interested in joining the Specialist Pharmacy Service Group, your application deadline is practically tomorrow. You need to email your application over no later than 9 a.m. on Monday, the 29th of June, 2026.
All right, let's bring it closer to home with Section 4, Local Pharmacy Updates.
This first local mandate actually has a very real-world safety impact behind it. If your pharmacy is in the BNSSG region, there is a strict new directive about methotrexate IM. Basically, the BNSSG ICB heard from rheumatology nurses that patients were getting really confused and even struggling to administer their medication, simply because they weren't getting the specific brand they were originally trained on. That brand is Metoject. So, GPs have already been told to prescribe using this brand name, and your pharmacy teams need to be fully prepared to dispense Metoject and confidently support your patients with any questions on how to actually use it. Sticking with our BNSSG pharmacies for just a second longer, consider this a literal flashing red light. A really significant number of pharmacies have still not returned their signed Local Enhanced Service, or LES, contracts for local patient group directions. The ICB needs these signed and returned ASAP. If you're sitting there wondering where your paperwork is, or you just have questions, you need to email Allison Mundell immediately and get this sorted out.
Now, shifting over to our pharmacies in the Baines area, you guys have a fantastic health resource right at your fingertips. There are free services available for anyone living or working in Baines. And the big one is the Exercise on Referral service. This is delivered by Dragonfly and GLL Leisure. Pharmacists can directly refer patients into this via a primary care network referral. Though just a quick caveat, you do need a clinician sign off to finalize it. Still, it's an amazing tool to keep in your back pocket for holistic patient care. Also, a quick safety note, if you're operating anywhere near Weston-super-Mare, please stay highly vigilant for suspected measles cases. There has been a recent outbreak locally, so keep your eyes peeled.
And all of this just perfectly illustrates the absolute tightrope community pharmacies walk every single week, right? I mean, on one hand, you have these massive, genuinely exciting expansions, like the new Men-B service and the wider flu cohorts, meaning we can protect more vulnerable people. But on the other hand, you're hit with these hard administrative deadlines, like getting RAVs set up by September 1st or rushing to hit the PQS aspiration window in July. So I want to leave you with this question, and maybe bring it up with your teams today. With all these expanding national services and brand new mandatory digital systems, how is your pharmacy going to adapt its daily workflow? How do you capture every single clinical opportunity without burning out your staff? It's a tough balance. Plan proactively, lean on the resources we talked about today, and we will see you next time on The Explainer.